Hi, in this module we are going to talk about the next vector-borne disease, that is dengue syndrome. So dengue, it's a collection of many types of diseases: dengue fever, dengue hemorrhagic fever, dengue shock syndrome. All these are classical dengue fever, probable dengue case. All these are like different diseases clubbed under a common heading known as dengue syndrome. We all know MCQ first, a little bit about microbiology. Dengue virus is a Den 1. You have 2, you have 3, and then 4 serotypes. There is no cross immunity between these serotypes. If there is one infection, it is not that 2, 3, 4 are protected or prevented. There is no cross protection or cross immunity between them. Den 1, 2, 3, 4, dengue virus is a type of a flavivirus. If we talk about the WHO system for dengue, the WHO has classified the SEER region. What is SEER region? Southeast Asian region. So our country, India, falls in that Southeast Asian region. In this, we have classified into type A, type B, and type C countries. Type C countries where there is no endemicity of dengue. That means it is the DPR Korea, Democratic People's Republic of Korea. B group contains Bhutan and Nepal, and there is uncertain endemicity. A group is hyperendemic, and we are part of the A group category. India, Bangladesh, most of the countries are in A group. We are hyperendemic for dengue. What do you mean by hyperendemic? Dengue will occur all through the year in all age groups. So dengue will occur all through the year in all age groups. That is known as WHO SEER region category A. Next MCQ. A little bit, MCQ number 4, I think. A little bit about the vector. So what is the vector? The vector, predominant vector for dengue is Aedes mosquito, Aedes albopictus, and Aedes aegypti. Aedes albopictus and Aedes aegypti. A few features about Aedes. I need to stop over here in case you have not seen the video on entomology on mosquitoes under the entomology section. Please go and see it, because then it will be easy for you to understand this process of dengue. So Aedes albopictus or Aedes aegypti is there. Aedes mosquito, a few features. It's a pure anthrophilic. Anthrophilic means it loves human. It doesn't love human, it loves the human blood. So it is a pure anthrophilic mosquito. It is known as a nervous feeder. Nervous feeder means it needs more than one feed at a single time. So it will strike multiple people at a, so it will strike this, then this, then this. So that's a property of this Aedes mosquito. Then the Aedes aegypti mosquito is known as a discordant feeder, whereas the Aedes albopictus is a concordant feeder. What do you mean by discordant or concordant? If it requires more than one feed to complete the goniotropic cycle, that is known as discordant. If it requires more than one feed to complete the goniotropic cycle of the virus, it is known as discordant. If it requires no extra feed, that is known as a concordant species. So please remember, Aedes aegypti is a discordant species and albopictus is a concordant species. I would also like to add over here about the vector, since we are talking about the vector, that do you know that one mosquito, if it is infected once during the dengue season, it remains so all its life. So once infected is always infected, always infective till the time it dies. There is also, since you have learned so much, there is also another feature over here. I would like to tell you in a very layman language. The layman language is that, do you know that dengue is something like a RTI, STI of the mosquito? What do I mean by this is that once the dengue infection infects the genital infection genital infection of the mosquito, in those cases, this mosquito may have a transovarial transmission as well, that the mosquito, whenever it will lay eggs, the egg will contain virus, they become mosquito, they will contain virus, they will give eggs, they become infected, and so on. It has a transovarial transmission. So if the genital infection occurs, then there is transovarian transmission of the dengue virus. That's an important characteristic of this virus, that there is a transovarian transmission in case of genital infections. Next, we talk about the environmental features. Environmental features are same as we have already talked couple of times. What is the suitable temperature of the Aedes mosquito? 16 to 30. It can stay in slightly cooler temperatures. Normal range is 20 to 30, but this can, we normally say the books, the WHO guidelines say 16 to 30. With a humidity of 60 to 80%. So remember, for mosquito, 20 to 30 is the degree centigrade is the lifespan, is the temperature span, and humidity is 60 to 80% of humidity is like most suitable. We have something known as uncategorized fever. What is this uncategorized fever? This is one type of classification, uncategorized fever. There is no features, no typical features of body aches and myalgia, no typical features of dengue syndrome. This may occur in people who have either previous, it is unknown mechanism, they may have some previous immunity, or it is said that first timer infections develop only a subtle infection and the subsequent infection is a severe infection. So that is known as uncategorized fever, nothing very special, no big MCQs on this. Next, you have a dengue fever. What are the features of dengue fever? Arthralgia, myalgia, and something known as retroorbital pain. This is like the most retroorbital pain. This is one of the most characteristic features of dengue syndrome. That is retroorbital pain. The fever, and of course fever. The fever in dengue, it starts usually within 1 to 2 days. It peaks at 2 to 3 days and then it resurges again at 5 to 6 days. So there is 1 to 2 days fever and then it comes again and then it drops at 5th to 6th day. So that's how it usually is okay. The patient becomes okay between 7 to 10 days. There is a recovery. So recovery within 7 to 10 days, there is bimodal presentation. There are 2 peaks of the fever, first within 1 to 2 days, next within 5 to 6 days. So this is known as dengue fever. It will involve, it may or may not involve platelet count less or no. I have not talked about the platelet count. So please remember, dengue is associated with low platelet count, but it is not a typical feature to have thrombocytopenia in dengue. The third is dengue hemorrhagic fever. Dengue hemorrhagic fever is what? It is dengue fever plus hemorrhagic manifestations. Any bleed from natural orifice of the body, that is known as dengue hemorrhagic fever. But of course, that's not a very classical definition. How will you say about the hemorrhage, right? So there is a clinical definition. The clinical definition of dengue hemorrhagic fever is using a tourniquet test. Using a tourniquet test. There should be more than 10 petechiae. If you tie a tourniquet on the arm, there should be more than 10 petechiae per square inch. That is 2.5 centimeter into 2.5 centimeter area. So per square inch, there should be more than 10 petechiae. That is almost a clinical diagnosis of dengue hemorrhagic fever. However, if you talk about the laboratory diagnosis, in dengue hemorrhagic fever, there will be a rise in hematocrit above the baseline more than 20%. It may or may not be plus or minus associated with the thrombocytopenia cytopenia of less than 100,000. So there is a platelet count of less than 100,000. Hematocrit increase of more than 20% of the current baseline level. Clinical definition would be a tourniquet. This is known as a dengue hemorrhagic fever. In case we are going to talk of the dengue shock syndrome, next we are going to talk about the dengue shock syndrome. When do we call as a dengue shock syndrome? The dengue shock syndrome is categorized as when the pulse pressure is less than 20 mmHg. The difference between the systolic and the diastolic comes to be less than 20 mmHg, or if the systolic blood pressure means systolic blood pressure is less than 90 for children, less than 80 for children, and less than 90 for older adults. Less than 90 for adults and less than 80 for children. Then we call this as a dengue shock syndrome. Next MCQ. How do we diagnose? What are the investigation of choice? In case the patient comes within 1 to 5 days of fever, then the investigation of choice is NS1 antigen. If the patient comes after 5 days of fever, the investigation of choice is IgM ELISA. MCQ, which ELISA will we do? We will do a McCapture technique. So that is the IgM ELISA that we are going to do using the McCapture technique. Next is we'll talk about the treatment for dengue. Treatment for dengue is IV fluids, resuscitation. This resuscitation has to be based on some of the maintenance fluids plus 5% extra for dehydration. These all things you must have read it in surgery. A few salient features from the guidelines for dengue management is that it is always preferred to use crystalloids over colloids as the initial management. However, there is no preferred way that colloids is better or crystalloid, but the guidelines say crystalloids would be obviously a better pick. If you start with crystalloids, starting with 0.9% normal saline is much preferred than using a Ringer's lactate as the initial fluid management. So this is used as an initial fluid management. But we all know that repeated large volumes of normal saline, I think everybody knows it, may lead to hyperchloremic acidosis. And when this may happen, in case of use of large doses of normal saline, then we may shift the patient on a Ringer's lactate, right? So now let us have a look at what is the baseline concept behind the management of IV fluid rehydration in the patient. So please remember that the IV fluid rehydration for the crystalloids that we have is we can give 10 to 20 ml per kg body weight. Then you just half it 6 ml, then you half it 3 ml, then you half it 1.5 ml. So these are the 4 classes of the fluid available to us. Now, when we have a patient with dengue hemorrhagic fever, maybe category grade 1 or grade 2, any grade, to this patient we will check the hematocrit. Of course, the hematocrit would be more than 20%. If the hematocrit is more than 20%, you start with crystalloids. Usually if the hematocrit is around 20%, grade is grade 1 or grade 2, not very dangerous grade 3 or grade 4. In those, what is grade 3 and grade 4? When there is systolic, when the vital signs are deranged, that is grade 3 and grade 4. When the vital signs are not deranged, that is grade 1 and grade 2. So in grade 1, grade 2, there is a rise in hematocrit. We will give to the patient crystalloids. So the concept is you start with the crystalloid average number, that is you normally start with 6 milligram per kg body weight given within 1 to 2 hours. So 6 ml per kg body weight given for 1 to 2 hours. And then you again keep on checking hematocrit. If the hematocrit improves, then you grade down from 6, you go towards 3, then you go towards 1.5. Are you getting it? That's a concept I'm trying to tell you. These are not direct algorithms, but this is the concept for doing the IV fluid resuscitation in a patient who reports with dengue hemorrhagic fever, grade 1 or grade 2. So you just step down on the IV crystalloids. Now in case the hematocrits do not improve, they do not normalize, Now in case there is no improvement, then what are we having? Either the hematocrit is falling or the hematocrit is rising more. If the hematocrit is falling, that is the standard guideline. If the hematocrit falls in spite of your crystalloid treatment or your resuscitation, if the hematocrit is falling, suspect internal bleed. Suspect internal bleed, start the patient on blood transfusion, blood products. So you need to give to the patient. Blood products. You start with blood transfusion. Okay, and then you check the hematocrit, keep on checking the hematocrit and the vitals. Now in case the hematocrit is increasing, that means the patient is still dehydrated. So now if the hematocrit is still increasing, you again increase the crystalloid, you again increase the crystalloid, you step up. How much up? You will increase at the rate of 10 ml per kg body weight. This is given for roughly around 2 hours, 2 to 4 hours. And you again check hematocrit. If the hematocrit is decreasing, go towards internal bleed. If it is increasing still, you move from 10 towards 20. And in case hematocrit improves, if it improves, so obviously you step down from 10 to 6, 6 to 3, 3 to 1.5. The stepping down is also important in dengue management. The stepping down on improvement, how to step down, it is usually taken as 6 ml per kg body weight for 2 to 4 hours. Then every 2 to 4 hours you will step down. Every 2 to 4 hours you will step down. So after 2 to 4 hours you step down to 3 ml, then you step down to 1.5 ml. So this is known as management for grade 1 and grade 2. In case the patient, the concept I am going to tell you about grade 3. Grade 3 management for dengue hemorrhagic fever. Now obviously in grade 3 the vitals are deranged. That means there is a narrow pulse pressure of less than 20 mmHg. There is a narrow pulse pressure. The vitals are not stable. The systolic blood pressure is less than 80 or 90 and the hematocrit has to be more than 20%. So in those cases, what do we do? Of course, there's a severe medical emergency. In those cases, you directly give crystalloids. Usually you start with 10 to 20 ml per kg body weight and you give it within 1 hour. Earlier you were giving between 1 to 2 hours. This has to be a loading dose of 1 hour. Then you check the vitals, because more important is not to observe the hematocrit right now, it is to check the vitals. If the vitals improve, of course you start your step down procedure. If the vitals improve, you start your step down procedure. If they do not improve, if there is no improvement, now in these cases, same concept is same for treatment of all dengues. It is just a different algorithm which works at a different level. The concept will be same. And now you check the hematocrit. The hematocrit, if it is more than 45%, then you step up the crystalloids, step up the IV crystalloids. If you are already giving to the maximum, you again give it for next 1 hour. So you again give it for next 1 hour. Crystalloids. In case it is more than, hematocrit is more than 45%. If the hematocrit is decreasing, of course, same answer. If it is dropping, you suspect bleed and you start the patient on blood transfusion. Again, you check the hematocrit. So the concept will be same. So you need to check for the hematocrit more than 45. You start step up or repeat the dose as a loading dose. So that is the main point for you to do, is to manage the vitals using a crystalloid. What is the crystalloid that we normally start with? Normal saline, that is 0.9% normal saline. So that is about the management of dengue at a PHC level. This is not at a very hi-fi center. So at a PHC level, this is the basic thing that we can do at a primary health center level. Next is we come to the monitoring and evaluation indicators of dengue. In monitoring and evaluation of indicators of dengue, in dengue we do something known as larval survey. That's an important funda for you, that what is a larval survey. You remember mosquito, you remember malaria. If you remember the malaria we were doing fever surveillance. Now we are doing larval surveillance. What do you mean by larval surveillance? Dengue is by which mosquito? Aedes mosquito. Where is the Aedes mosquito? Outside house, inside house? Inside house. So where, in which water inside the house? In the drinking water, stored water, contained water. So in these containers inside the houses, the Aedes may go and give the eggs. So now you do a larval surveillance. We send people to their homes and they will do a larval surveillance to find out how many containers contain the larva. That's all. So there are, based on this larval surveillance, there are a couple of indices. Just see, there is 1, 2 and 3 indices. So if you see the number of container positive divided by the containers checked, what will it be called as? You tell me, what will it be called as? If it is known as, if it is container positive in the houses, I checked 20 containers today, out of them 2 is positive. What is this? This will be known as what? Simple answer, it is known as container index, CI. It is called as CI, container index. If I check the number of houses positive for larva, Aedes larva, right? That's what we are talking. Divided by number of houses checked, what will that be known as? Container by container is known as container index. So house by house will be known as what? House index. Obvious answer. Now this is what is the MCQ. Now this is what is the MCQ for you. If I see, just look at this, don't get confused in your exam. I know now it might be looking very ultra simple to you, but in the exam, this is the most common point where the student just jumble them up. So you just get confused. That's what I'm telling you, that I'm telling you the mistakes which students do. So please try to understand, if I see the number of container positive, number of containers positive divided by the number of houses checked, that is known as BRETEAUINDEX. That is known as Brittio index. So what is Brittio index? Brittio index is container positive by houses checked. Please try to understand container by container, container index, house by house, house index. Container by house is known as Brittio index. So Brittio index is one of the most sensitive criteria. It is a sensitive criteria to find out the dengue endemicity in the area, at least for National Vector-Borne Disease Control Program, that is the Indian system. Next is after doing the monitoring evaluation indicator, last point for you is that there is a global strategy. That is a small target you need to remember. Global strategy for prevention of dengue in the countries. So that's a global strategy. It was started in year 2012 till 2020. You just need to remember 3 targets of this. We need to decrease dengue mortality. We need to decrease dengue morbidity. That is number of people suffering from dengue. And we want to control dengue in all areas and countries. So that's a global strategy. So how much mortality to be decreased? So if you take 2012 data, by 2020 in the 8 years, the government thought, the WHO people thought that we need to decrease mortality by how much? MCQ, we need to decrease mortality by 50%. You need to decrease morbidity by 25%. So that's all that you need to remember for global strategy for dengue: to decrease mortality by 50%, to decrease morbidity by 25%, to control dengue in all areas. So with that, we have finished dengue. Thank you so much.